So maybe I'll stand at the table to speak tonight. Thank you so much for having me here tonight. It's a great honor and thrill to come to this great place. I must admit that my wife and I have been coming here the last 5 or 6 years for our physical exams. And I'm fond of telling anybody who asks that I think Mayo is the best quality, the most intelligent, and the most effective health care in the world today. And I'm always thrilled to come here to see the operation and to meet people and to see the great care. And what I love best about it is the ethics of the Mayo brothers, which are expressed still today through all of the people at Mayo, in caring first, last, and always about the patient. Not about the doctors, not about the nurses, not about the buildings, not about the finances, all of which are very important, but they first, last, and always care about the patient. And that, to me, has to be a very important part of healthcare. I'm also glad to be here because I got so well introduced by John. I appreciate that. You know, when you've been in public service for as long as I was, on C-SPAN, CNN, all the networks, thereafter, after you retire and you go out in public places, airports, restaurants, people come up to you and they know they've seen you before, but they struggle with who in the world I am and where they met me before. People think I sold them an insurance policy or a car, or the best one was there were a TSA worker in Atlanta. I was going through the airport. My stuff was going through the X-ray, and she was staring a hole through me, and I knew we were into one of these identity crises, and finally she just said, I've been looking at you, and I knew you, and I finally remembered who you are. I said, great. Who am I? She said, you played Batman in the last Batman movie. You can't make these stories up. So, an even better story is I was in the Chicago airport about 6 months ago, and we were waiting for the airplane, and 3 kind of senior women came up to me, and they remembered that I had been in politics, that I had been the Democratic leader. They were Democrats. They were very complimentary of what I'd done and issues that I had worked on, and they were just laudatory. I mean, it was just overboard stuff. It was embarrassing. And while they were doing this, a young man came up behind me. I couldn't really see him, but I knew someone was right close to me. And while they were talking, he whispered in my ear the following: don't listen to this. I always thought you were an asshole, and you're still an asshole. Is this a great country or what? I mean, you can have A to Z right in front of you at the same moment. He didn't even let me debate it, though. He walked away. So we're here to talk about health care. And we're here to talk about health, and we're here to talk about innovation in healthcare. And I'm really happy to be a small part of this effort. Dr. LaRusso and his colleagues I've met with before here, and I'm so excited about what they're trying to do, because I think what they're trying to do is so important, and what you're here to try to talk about and figure out is so important. And I think that because if you really step back and look at health status, health care, whatever you want to call it, health, it is the most important thing to every human being on the planet. It's not just another product. It is the most important thing. I'm fond of saying to people, you could be Bill Gates, you could be Warren Buffett, you could be some other wildly rich person, wealthy. But if you lose your health, all the money doesn't mean a thing. It's meaningless. So this is a product that people want and value over every other thing when they're making choices of what they want. I'm on the board of Ford Motor Company, and we're struggling, as all the companies are, to do well in the auto industry. Very tough, competitive industry. And I've often thought if we bought automobiles the way we buy health care, there would be no Ford. Or there would be very few Fords. But if, as a consumer, I wanted to go out and buy a car, I'd first go buy the wheels, and then I'd buy the axle, and then I'd buy the doors, and you get the point. Healthcare, more desired than any other product, but there's no product like it. We say when you buy a car, emotion enters into the decision. And at Ford, we talk a lot about that. We want the car to really look neat so that a lot of consumers say, I don't know what the mileage is, I don't know if it has great quality, but I want that car because it really strikes my fancy. I like the way it looks. That fits my personality. Healthcare is an even more emotional subject. There's nothing more emotional to people than, am I healthy? Will I live longer? Can I survive? Can I have a longer life with quality? So what you're here to talk about is an unusual product, one that's most desired, and one that also involves a lot of emotion and a lot of complicated human emotions around it. Some other factoids that I think are important before we start talking about what's positive and what's negative today about healthcare. Another one that I've always been interested in, I've studied the healthcare system in lots of countries: Canada, England, Germany, Russia, China, you can go down the list. I've been to a lot of these countries, and I've seen a little bit of their healthcare system. Let me tell you something. Nobody's figured this thing out. I mean, if we think we haven't figured out healthcare, just go anywhere else, and they're in the same boat. Everybody has the same set of problems. How do we pay for it? How do we make it more efficient? How do we do this better? How do we get everybody involved in it? Blah, blah, blah. So nobody has figured it out. Some other factoids that I think are important is there are few industries or areas where a few people spend most of the money. A few people spend most of the money. The fact that I've often heard, it may not be exactly correct, but I think it's pretty much correct, is that 20% of the people spend 80% of the money. So that makes you think, well, maybe we better start, if we're worried about cost and spending money, we ought to look at that 20% and what we can do to make some progress there. The other one that always got me, I was on the Ways and Means Committee in the House, and we had jurisdiction over Medicare. And one of the factoids that really always blew my mind was that about 38% of Medicare spending is spent in the last 30 days of life. That always really stopped me. And it really made sense to me when I went through this with my mother, who died at age 95. Very fortunate. Always in good health. She did calisthenics every day. She would always tell me, Dick, use it or lose it. She was terrific. She just took care of herself. She was great on health. Prevention. And toward the end of her life, she was in an assisted care facility, and she was starting to have a cough, and so they took her over to Washington U to Barnes, and they did some x-rays, and she was having some problems with her heart, and the doctor said she's got congestive heart failure, she's got some spots on her lung, these are the things we can do, blah, blah, blah. He went through all the procedures they could do. And I said, whoa, I said, would you do this if it was your mother? And he said, absolutely not. We're not going to extend her life. We're just going to cause pain. He said, get the hospice and it'll be, you know, no one wants their loved one to die, but this is as good as it gets. We did that. And it was unbelievably more positive than I thought it would be. We celebrated her life for 3 months. We got the pictures together. We got the family together. We talked about what she had done in her life. We talked with her about what she had done in her life. And the day that she passed was not a good day, but it could have been a lot worse if we had not taken the doctor's good advice. So there are some important facts about this product, and there are some important things to keep in mind as we go through a little bit of a discussion. So let me give you positive news, good news that I see out there today with our healthcare system in America. Let me give you some bad news, some negative news, and then I'm going to end up with optimism and some good trends that I think we can all look at and work on and talk about to try to make more sense out of this. Good things. When I was a young kid, when you hit 65, I'm 71 years old. I grew up in St. Louis. When I was a kid, when people hit 65, they died. I'm convinced that's why we set the Social Security retirement age at 65. I mean, some guy in Germany figured that out. I mean, if you set it at 65, you never have to pay anybody. So, and that's what happened. I grew up in a working class, lower middle class neighborhood. My dad was a truck driver. We never had much money, but we had a doctor who lived next door to us, Dr. Abel. And that was our doctor, obviously. I mean, you know, couldn't go to anybody else. And Dr. Abel practiced medicine in what had formerly been a barber shop in South St. Louis City. And when I got something really bad, I mean a really bad cold or a bad chest cold or some problem, my mother would take me to the barber shop to see Dr. Abel. And he put me up in a barber chair. That's where patients were presented to Dr. Abel. And he would stick that damn thing in my tongue and choke me to death and look at my throat. And the only thing he really had to prescribe, I think, was sulfa. I don't think we had penicillin. Maybe we did, but he was still dealing with sulfa. He had to drink all the time. He couldn't do anything. He couldn't diagnose anything, and he couldn't do anything. That was healthcare, 1948. Think of what we have done. Just stop and think of what we have done. Life expectancy in the United States is not 65, it's not 75, it's almost 80 for both genders. And the prediction is that it will go beyond that, and I believe that. So anybody who says this healthcare system, whatever it is, has not succeeded is not paying attention to the facts. The facts are it is succeeding. It's doing a tremendous job for a lot of different reasons that we can go into, but the bottom line is it works. It's achieving its goal. If the product that people want, the outcome people are willing to pay anything for, is a longer life expectancy with quality, we've done it. We're doing it. And so that's a real positive. The second thing, it's interesting to me, is that we're not doing it through cures of diseases so much. There are some. But we're doing it by managing chronic conditions and difficult conditions and keeping people alive for a longer period of time. I've just noticed in the last 10 years, you know, people that got a certain kind of cancer 10, 15 years ago, they just died right away. Now they're going forward. It may not be a great quality of life in some cases, but in other cases it is, but they're living longer. We're managing. We're not curing, we're managing. So when I was a kid, again, another anecdote, I grew up in St. Louis, and I grew up in the polio period. My mother wouldn't let us go to the swimming pool. We were kept in the house all summer long. Everybody was panicked over polio. I was panicked. And then I remember the day the ambulance came to the street behind us and picked up a little girl whose name I still remember. I won't use her name. And they brought her out of the house in an iron lung. And the whole neighborhood was standing there watching this. It was terrifying. And then a few years later, you read that Sabin and Salk had found these cures for this. We could prevent this. I'll tell you one other cute side note. After she had come out of the house in the iron lung, that summer, our little family, I had one brother, my dad said, we're going to go on our first and only vacation. We had never been out of the city on a vacation. So we got in the car and we drove to Kentucky Lake. And the morning that I got up to get in the car to go to Kentucky Lake, I'm sure it was because of what I'd seen, my legs felt numb. And I thought maybe I was getting polio. I didn't tell anybody, but I was scared to death on the whole ride. It took like 5 hours to get to Kentucky Lake. The minute I got out of the car, we had a little cabin right on the lake. I walked as fast as I could because I thought I was getting polio, and I got my legs in the warm water because I'd read about Franklin Roosevelt going to warm springs. And I cured myself. Remember I said healthcare is emotional? Believe me, I get it. So we're managing chronic conditions. We're curing some things, but we're more managing and extending life through better management. And finally, I think we're seeing some better efficiency. We are seeing some better managed care, I guess is the way I could put it. 20 years ago, we had this new fad, HMOs came in, right? We had HMOs. We had some good HMOs in Minneapolis. We had some good HMOs in Seattle. We had a few in California, and that was going to solve the problem. And then everybody wanted to get into the managed care business, and then people started getting denied, and then we had to pass acts in Congress to keep people from getting denied, and it just all fell apart. But with all that said, in my view, there is better in some places in the country, and this is the best, but in some places in the country, we are doing a better job at managing patients effectively for higher quality and lower costs. Now, what's the bad news? Medical inflation, medical costs off the charts. I was telling Dr. LaRusso a few minutes ago, I have two firms, and my other firm is with my son, and we do labor management relations all over the country, and we work with companies and usually unions, not always, to try to get a better relationship, to try to have more collaboration, more productivity, more success. Everybody's in the same boat. That's what we preach. And we are right now involved in 3 strikes. We're involved in even more negotiations, and the only issue in all these situations is healthcare costs. Period, end of story. There's no problem with compensation, there's no problem with the pension, there's no problem with work rules. All that's been shoved aside. It's all about healthcare costs. We're working with a company in West Virginia. The family premium for their employees in rural West Virginia is $18 grand a year. And, you know, everybody's got a one-eyed cat. They got an answer for this. Oh, let's just put more cost on the patients. That's what the companies say. That's what they have to do. They got to put it somewhere. But then the patients rebel and say, I can't pay for all. And nobody wants to hold the hot potato. But we've got to pay attention to this, or we can't compete in what's obviously a world economy. I mean, this aluminum company will go out of business if they can't get the strike settled, and they'll have to take their productivity somewhere else. So that's number one bad news. Second, prevention and wellness still doesn't quite get there. We're doing better, and everybody talks about it, but boy, doing it is really hard. It's really hard because when you stop to think about it, our personal behavior every minute of every day is probably the greatest contributor to our health status. Every time I eat, every time I put something in my mouth, I'm affecting my health status. Every time I try to go to sleep at night, and I've had increasing problems with that because I guess I don't have melatonin or something. I don't know what's going on. But every time I try to get 8 hours of sleep, I'm affecting my health status. And I've just noticed, this is anecdotal again, I have an internist that we work with outside of here. They work with Mayo and, you know, coordinate the care. But for the first time, I've been going to this internist for probably 15 years. For the first time, he's talked to me about my weight every time, but he's never talked to me about what I eat. And now he's starting to give me advice on how to eat. He wants me to be a vegan. I guess he heard about Bill Clinton. I don't know what it is. But this is amazing to me that a doctor is talking to me about what my diet should be specifically. So we're still struggling with this, but there's a lot of gains that I think we could make in that area, and we haven't done well enough. Third, the system is still unbelievably disorganized. It's the only cottage industry in the country that spends 17% of GDP. It's doctors, it's nurses, it's surgery centers, it's MRI centers. I mean, you can go down the list. Everybody is, you know, doing their own thing. And many of them are doing great stuff. I'm not being critical. It's just that the thing is disorganized. Hospitals, people come into the hospital, they treat them, they deal with them, the doctors deal with them, they discharge them, they lose track of them, there's no record, there's no follow-up, it's an unbelievable mess. And there are very few national players. So when we're working on this strike in West Virginia and they're saying there's no health care here. I mean, there's Blue Cross and there's a few docs and there's a hospital and that's it. I mean, it's like you either buy a Ford or you buy a Ford. That's it. There's nothing else. And so I said, well, is United Healthcare around here or is Kaiser or somebody? And they said, no, it doesn't exist. So largely, it's a cottage industry and it's a regional situation, almost down to the little village or town and the way it's dispensed and practiced. So that's the bad stuff. That's the good stuff. Let me give you some good trends. Number one, and I know this may be controversial, the Accountable Care Act, very controversial, always will be controversial, at least for a long time, in my view. I worked on the Clinton health care bill that Hillary had, 15 years ago. I know all the problems. I know all the debates. no matter what anybody says, getting everybody involved in healthcare has got to be a good thing. Now, we can argue till the cows come home about how we do that, and I understand that, and I understand the controversy. But to me, that's a good trend. I mean, if we can get everybody involved, that's a good thing. And the auto insurance analogy is, I think, the right analogy. You know, in Missouri, where I'm from, you cannot get a license to drive a car, and you can't get in a car unless you have collision liability insurance. Well, if it's so important for that, then this is the same thing. I mean, everybody's going to have a problem, and everybody's going to have some costs. So getting everybody involved, good trend. We can argue about how it was done, whether it should have been done another way. I'm sure that will not subside. But I think most people could agree getting everybody involved is a good thing. Number two, the information revolution, and along with the Accountable Care Act and some of the innovations they've tried to put in it, I think give potential for high-quality organizations like Mayo, like Kaiser, like some others, to push best practices, prevention and wellness, management of chronic disease, and organization of care to a national level. Now, that's a controversial statement. There are many people who would say we don't want this to be big institutions. We want the cottage industry. We don't trust these big institutions. This is not like fast food. There's a guy who wrote an article in the New Yorker a week or two ago about, you know, the fast food industry is a good analogy for what needs to happen in healthcare. I don't know if that's really the right argument, but there is something to what he was saying, because he was saying that when a patient presents with a certain diagnosis, with a certain set of facts, you can have 20 different prescriptions for what to do depending on the doctor you see, and there's just no uniformity. There's no best practice. You got to believe that both the information revolution and the ability to connect facts, to connect information with people, with organizations, and the ability to get best practices, to get prevention and wellness out there, to do a better job of education will be a good trend. Third, I think the continued support for research, scientific research through mainly the NIH, is going to keep on. When I was minority leader, Newt Gingrich was speaker. In case you don't remember, we didn't agree on a lot of things. One of the things we agreed on was NIH research. And so together with all the other members of Congress and Bill Clinton, we were able to get NIH research increased over a 2-3 year period from about $15 billion a year to $30 billion a year. That's the good news. The bad news is it's been stuck at $30 billion for 10 years. And that's a problem. And we need to take that cap off, and we need more. Because if you stop and think about it, the research, which largely fails, I mean, most of the research that's done doesn't come up with a solution. But it's expanding human knowledge. It's discovery of scientific facts. I saw the article just this week that they found the switches in the genome, whatever in the world that is, they think can really be an exciting prospect for finding answers to problems. That would never have happened without NIH money. It's the best money we spend. And if we could spend more, we could, in my view, move faster, get more answers, get more knowledge, and find ways to hold down costs, to prevent disease from being really awful, and even curing some disease, and certainly how to better manage disease. Fourth, and I want to say this in the right way, the usual public discussion, if you listen to the speeches in the convention the other day, both conventions. Everybody talks endlessly about how are we going to cut Medicare? How are we going to control the costs in Medicaid? How are we going to get our hands around the cost vector in healthcare? It is the political issue. And if you look at the budget, there is only one issue in the future deficit path of our budget. It's healthcare. Social Security we'll figure out. It's easy. We know what's going to happen with Social Security. I mean, we may have to raise the retirement age, but we know what's going to happen. Healthcare is just, it's like a marshmallow. And so everybody talks about it endlessly because it's the only issue. There is no other issue in the budget. Yeah, they'll fight about taxes, they'll fight about defense, they'll fight about Social Security, they'll fight about the other parts of the budget, but all that's kind of easy. We did it. We know how to do it. Healthcare? Oh, whoa. The worry has always been that because of the fiscal problem, the fiscal cliff, whatever you want to call it, that we will just make mindless cuts in healthcare. And what I want to say to you tonight, it isn't going to happen. They'll talk about it. They'll talk bravely about it. They'll even enact some of the cuts. We did it a number of times in the 80s and 90s. We cut the hell out of Medicare. And how did we do it? By cutting the doctors in the hospitals. And then when they came to complain hotly with their constituents, we put all the cuts back immediately. We're not going to cut health care, but we got to do something about it. And the only thing to do about it is what I've talked about. You got to organize it. You've got to find better answers for death and dying. You've got to organize the way health care is provided. You've got to come up with new ideas. You have to use the information revolution, and on and on and on, all of which is designed to hold down costs by increasing quality. Hold down costs by increasing quality. And in fact, in my view, it's the only way it can be done. We did a study at Medicare over the last 10 or 12 years. We took patients with 4 or more chronic diseases. Their usual cost had been about $28,000 a year. That was the cost of Medicare to take care of these people. The VA had a part of it as well. We convinced this model group, and it was about 10,000 people as I remember it, to go into managed care. That was the first big step. Tough, but we convinced them. They were going to be part of this experiment. And then we had, we did a better job of managing their chronic problems. We had more nurse practitioners on the phone with them, talking to them regularly, trying to get them to behave. Some of them were pre-diabetic, some of them were diabetic. But we did a better job in both cases of slowing it down. And the facts are that over 10 years, we saved on that group $8,000 per head per year. $8,000 per head per year. Now, why did we save the money? We kept them out of the hospital. We kept them out of the doctor's office. We didn't have to cut their feet off. They were better off. Medicare was better off. The country was better off. We increased quality and held down costs because we were able to make some simple changes in the way these folks got health care. Finally, I'll end with kind of where I started. The really probably best news is that people want health care. They want health in their lives more than anything else. If you're involved in the healthcare industry per se, you're in the most popular industry in the country in the history of the world. And there's another side benefit to having this tremendous value that people put on health. It is the fastest growing employer in the country. It is the largest employer in every city in the United States. Nobody ever talks about that. I said I was on the Ford board. We've lost millions of manufacturing jobs in the United States. I'm from St. Louis. We used to be a manufacturing center. We have nothing anymore. What's replaced it? Thank God. Healthcare. Healthcare. Because people want it so much. So if we just do a little bit better, we'll never do completely better, because this is an intractable history of the way healthcare grew up. It is what it is. You're never going to change it overnight, and you're not going to change it dramatically, in my view. But incrementally, we can do better to deliver what people want more than anything in the world in a better, cost-efficient, and valuable way, so we can all have what we so much want. I'll just end with one final anecdote. I have a son who I work with every day. He's 41 years old. When he was 18 months old, he was diagnosed with terminal cancer. He had a huge rhabdo on his prostate. It was one of the first reported cases in the country's history, we were told at Washington U. And the pediatrician and the oncologist who did the original diagnosis said, this thing is huge, it's invaded his entire abdominal cavity. There's nothing we can do. Because we can't operate, it's too big, it won't work. The next day, a young oncology medical student came in the room, and he said, I was so upset by the diagnosis you got yesterday. I got on computer. This is when computers, what's on your iPhone would fill a room. and so he said, I went on computer and I found, this was 1972. He said, I found a triple drug therapy. I think it was at MD Anderson. It could have been St. Jude, I forget. And he said, we don't think it'll work, but we'll try it. And we've talked to the radiation people, and we think if we can zap him with max radiation, give him max chemotherapy, we'll try not to kill him with both. We'll give it a try. Don't get your hopes up, but we think it's worth a try. And then the pediatrician came in and said, I don't think you really want to do this, because even if it worked, you're going to fry this kid's abdomen, and the side effects are going to be really awful. And you really ought to think about this. So we went home and thought about it, prayed, came back, and we said, let's go. 5 years later, we got the tumor down. They got the tumor down in the first 3 months with radiation and chemotherapy. Took out his bladder, took out the tumor, took out his prostate. And he was fine. And every day that went by, we were worried that it would come back in some form, but it didn't. And then I began to worry that he's going to wear a bag for his urine, and the kids are going to make fun of him, and he's going to feel sorry for himself. And this is not going to be good. And somehow, miraculously, mainly because my wife told him every day how lucky he was, he to this day thinks he's the luckiest person in the world. And he is. And he is. It's a great kid. He went to Duke University for college, Northwestern Business School. I work with him every day. He runs this labor management practice. It's a gift of God. It's a gift of God. That's healthcare. That's what it means to people. So what you're involved in here is not just good and not just important. It's really important to every human being in the world. Thank you very much.